You are a fantastic community resource. And as I've said, we refer our clients to you for assistance. So tell me, what's new, if anything, with Medicare, and how do you think that's going to impact a person's ability to get Medicare or make the right decision about what they need?
A few new things that I've seen so far this year is they are restricting some of the commercials that you see on TV, some of the advertising they do. A lot of it ended up being kind of misleading and leading people into thinking that they could qualify for certain things just to basically get their phone call, enroll them into something that's really not going to help them when it comes to their health. So they're limiting those commercials and advertisements, really putting some restrictive measures into effect. That's one of the big things I've seen. The other big thing, which I won't go on, it's not too exciting. People don't like hearing the percentages as much, but for the drug coverage, they're getting rid of the catastrophic coverage phase. That's more related to the drugs. So hopefully that'll save some people some money. I know once people hit what they call the donut hole, the gap coverage, it gets very expensive. So the phase after that, they're cutting that off. So
could you explain to people what that donut hole is? And literally, I want everybody who's listening to this, imagine in their mind a donut. So you've got the donut and you got a hole and you're going to come out the other side. So tell us about the impact of a donut hole in the context of Medicare coverage.
Okay. So with your drug coverage, you pay your copays leading up to the certain amount so this number changes just about every year, but so you have your copays. So that's the money you're paying. And then the insurance company also pays toward that drug every single time you get it. So it all goes to the pharmaceutical companies. So once the money that you've spent and the insurance company have spent together and it reaches this gap, then you start paying a much higher percentage and it can get very expensive. I know doctors don't like it as much because a lot of times when people hit that number, they can't afford it anymore. So they stop taking their medications. So it's been going back and forth over the years and trying to figure out a way to cut this out completely, but they still haven't really come down to it. But
so for this year, what's the number that's sort of the top of the bottom of the donut hole, if you will? So we're going to work our way through that first part of the donut. What's that level before we get to the hole?
It's around $4,700. I can't remember the exact number off the top of my head, but once.
So go ahead. So then we get through that 4,700. Where do we start again with the more equitable reimbursement or formulas?
So it's about $3,000 more after that. And during that phase, you're paying 25% of that prescription cost. It's around 7,000. I don't have the exact number right in front of me. It's in the 7,000s. So there's a nice little donut hole where all of a sudden your prices jump up tremendously compared to your copays.
So Hunter, I get to the first part of the donut and then I'm in the hole and I'm paying 25% of it. And I get to that $7,000 number approximately. After that, is there another ceiling that we have to be concerned about, or does that reimbursement formula remain the same as it was before?
So that's where they're going to get rid of that catastrophic coverage phase. So once you get over the hump, then the insurance company is going to be responsible for it at that point. So your costs will be cut out, and it's around 5% before, where people were paying about 5% or the $4 something for the copay after the donut hole was over with. So after you make it through the donut hole, then you're going to jump out on the other side and the insurance company is going to cover it.
Okay. So advertising, donut hole in terms of catastrophic drug reimbursement. Anything else new on the horizon for Medicare?
In a whole, not so much. Another big thing to consider is just market share. The companies coming in and out of the market and making things more competitive, bringing you more benefits, things like that. You should always be on the lookout for at the end of every year. and as we get closer and closer to annual enrollment.
So, what are the kinds of things that people should be looking for during this enrollment period? And what is it that you do to help people find the right coverage and make the right decision for their personal and unique circumstances?
So I would always say make sure your doctors are still in network. They come in and out of different networks all the time with the negotiations between doctors groups and insurance companies. The formularies, your prescription drugs, they go up and down on the tier levels. Co-pays go up. So that's always something to look out for as you go into the new season. Double check. Go ahead.
And so when you're there trying to help someone, exactly what is it that you do and how do you help them make the right decision?
So I'm an independent health insurance agent. So I've contracted with several companies. So the way that I come in is I'm able to take your prescriptions, your doctors, your financial needs, networks, a lot of different things, a lot of different factors, and put it into a system, and it populates different plans. That way we can look to see which plans have your doctors, which one's going to save you your pharmaceutical costs, your drug costs, and help you decide which way to go when it comes to the cost on your price. Are you wanting to pay for a large group of a network, or are you okay with a smaller network to where you can save some more money?
So if you were helping me to find a policy that would be appropriate for me, what are the kinds of pieces of information that you would want to know to, I guess, plug into this program that would help you get the right answer for me?
Big question I would ask, first thing I'd start off with is, are you planning on moving and traveling a whole bunch? If that's the case, then there's certain plans that are focused more on having those nationwide networks. And if it's something that you're planning on staying local, then there's local plans where it can save you money.
Well, then obviously you want to know what their prescriptions are, correct?
Correct. And so prescriptions playing a huge part of it. Every single company has a different formulary. They all have different funding, and they can determine where they want to put it. So they have certain plans that help with the heart problems, breathing issues, things along those lines. Every company is different. So doctors, the network, number one, pharmaceuticals, number two, and then what you're looking at for like your financial, for how much you want to pay for co-pays and max out of pockets, things like that.
So it's going to be location, your medical condition, the type of doctor that you're seeing, the type of prescriptions that you're getting, and then what you're able to afford. Would those be like 5 factors or pieces of information that you're considering and trying to make a recommendation?
Yes, ma'am. There's a few other things, but they're all, unfortunately, there's no plan that fits all. It's all based off of individuals and what they need for their healthcare needs. So every situation's been different when I go out and have an appointment with somebody or talk to them over the phone.
Great. We're going to take a break, and I've got a lot of questions for Hunter about the whole process and tips and questions that people should be asking. So let's take a quick break.